People who have been in a car accident are often diagnosed with a bulging disc, which we call a disc protrusion. The logical question for the injured person is quite obvious. What is a bulging disc and how badly am I hurt? A bulging disc, also known as a disc protrusion, occurs when one of your spine's cushioning discs weakens and expands outward, similar to a hamburger that's too big for its bun. While still contained within its outer layer, the disc's soft center pushes against its exterior, potentially pressing on nearby nerves. In more detail, imagine your spine as a stack of building blocks, vertebrae, with specialized shock absorbers nestled between each block. These shock absorbers are your intervertebral discs, crucial for allowing you to bend, twist, and absorb the impact of daily activities. Each disc is a marvel of engineering, consisting of two key parts, a central gel-like core called the nucleus pulposus, and a tough, fibrous outer ring known as the annulus fibrosus. Think of it like a jelly donut. The jelly in the middle is the nucleus, and the doughy part surrounding it is the annulus. So what happens mechanically with a disc protrusion? Here is a more detailed explanation. Now let's delve into what happens in a disc protrusion, often referred to as a bulging disc. Over time, or due to specific injuries or repetitive strain, the annulus fibrosus can weaken or develop microscopic tears. When this happens, the nucleus pulposus, still contained within the weakened but intact outer layer, begins to press outwards. This outward pressure creates a bulge that extends beyond the normal circumference of the disc. It's like the jelly in the donut pushing against the dough, causing it to swell outwards without actually breaking through. This bulging is a significant stage in the spectrum of disc issues. It's important to distinguish it from a herniated disc, also called a ruptured or slipped disc. In a herniation, the annulus fibrosus actually tears, allowing the nucleus pulposus to escape and leak out of its normal confines. While both conditions can exert pressure on nearby structures, the mechanism and potential severity differ. A protrusion represents an outward deformation, whereas a herniation involves the actual displacement of the disc material. Now the million-dollar question. What is the harm caused by disc bulging, which again is also called a disc protrusion? The clinical significance of a disc protrusion lies in its potential to impinge upon the delicate spinal nerves that exit the spinal canal near the intervertebral discs. These nerves are responsible for transmitting signals between your brain and the rest of your body, controlling sensation and movement in your limbs. When a bulging disc presses against one of these nerves, it can lead to a variety of symptoms. The most common symptom is pain, which can be localized in the back or neck, depending on the location of the affected disc. However, the pain can also radiate along the path of the compressed nerve. For instance, a bulging disc in the lower back can cause sciatica, a sharp shooting pain that travels down the buttock and leg, sometimes reaching the foot. In addition to pain, nerve compression can also result in numbness, a loss of sensation in the affected limb, tingling, often described as a pins and needles sensation, and muscle weakness, making it difficult to perform certain movements. The specific symptoms experienced depend on which nerve is being compressed and the degree of compression. Fortunately, not all disc protrusions cause noticeable symptoms. Some individuals may have bulging discs that are discovered incidentally during imaging tests for other reasons and never cause any pain or discomfort. However, when symptoms do arise, a range of treatment options are available. Treatments for disc protrusion almost always start with conservative management. This may involve a period of rest to reduce inflammation, physical therapy to strengthen supporting muscles and improve posture, and pain medication, such as over-the-counter or prescription non-steroidal anti-inflammatory drugs, NSAIDs, or muscle relaxants to alleviate pain and inflammation. In some cases, epidural steroid injections may be administered to directly deliver anti-inflammatory medication to the affected area around the spinal nerves. If conservative treatments fail to provide adequate relief, or if the symptoms are severe and significantly impacting the individual's quality of life, more advanced treatments may be considered. These can include minimally invasive procedures or, in more complex cases, surgery to relieve the pressure on the affected nerve. the specific treatment approach is always tailored to the individual's unique situation, considering the severity of their symptoms, the location and size of the protrusion, and their overall health. Commonly, in vehicle accident cases, you will see a progression of treatment from gentle chiropractic manipulations, physical therapy, exercise and stretching, to more invasive procedures. The more invasive procedures can include injections, radiofrequency ablation, and as a last resort, surgery. Thank you for watching. I hope this assisted you.
The law office of Daniel Horowitz represents people injured in motorcycle, car, and truck accidents. We have accident and medical professionals on staff to document all of your injuries. Call us at 925-283-1863. There is no fee until you recover money. Again, our number is 925-283-1863.